Welcome back to another month of the PigX podcast. I'm your host, Delaney Howell. In today's episode, we're diving deep into research focused on swine health detection and key performance indicators in swine production. While today we'll barely scratch the surface of some of the research and work that has been done in this space, you can find additional resources in our show notes. Today's guests are Dr. Gustavo Silva, an assistant professor in veterinary diagnostic and production animal medicine at Iowa State University, and Dr. Mafalda Mil-Homens, a veterinarian and PhD candidate. They share their global experiences and discuss how their research addresses the needs for improved health detection resources in the swine industry. Their work focuses on earlier disease detection, enhancing the value of data without the need for additional farm technology, and providing a clinical definition to better understand PRRS. There's a lot of valuable information in today's episode, so let's start by learning more about our two guests.
My training, I got a DVN back in Brazil, and then I work in the field as a swine practitioner, most focused on production, swine production and health. And then I did that for a couple years, and then I did a master in veterinary pathology. But then I moved and switched gears, and then I did a PhD in veterinary epidemiology with a minor in statistics. So basically, I was doing a lot of work on biosecurity. And then I came to the West to spend a year as a visiting scholar. And once I finished that, I did 9 months as a postdoc under Dr. Daniel Linhares. And then I moved to Carthage to work there as a couple years as a research scientist. So I was basically in charge of their applied research program and working with internal and external clients to perform their research under commercial conditions. And then 2021, I returned at Iowa State University to work as assistant professor.
Perfect. Mafalda, what about your background?
I started my vet degree in 2014, and I completed it in 2020 with a master's focused on dairy cattle biosecurity. I worked for 6 months in a company here in Portugal, with also focused on dairy cattle biosecurity and welfare. And then in the fall of 2021, I went to Iowa State University for a master's and PhD. I completed a master's focused on biosecurity in supply entry rooms in swine farms. And then I started working on my PhD that is focused on disease surveillance. And I also completed a minor in statistics. And now I'm going to start working as an epidemiologist at the university in Barcelona.
Those are both really interesting backgrounds. I appreciate you both sharing those with me and with the listeners. So I'm curious to know a little bit more too about how your paths have crossed. Obviously, we're going to talk today about KPIs on sow farms and using those to better help with health detection. But how did your two paths cross? And are you guys doing research together currently today, or what's the connection here?
Yeah, so that's a good question. In 2021, when I returned to State, long story short, I did some of the research preliminary work on using productivity data to investigate deviations on productivity. And then, but I dropped that line of research when I moved from the academia to working in the industry. But then moving forward a few years, when I started I State again, one of the research areas that I was interested is how we could use better and more the data that is already collected at the farm. So basically, I was looking for a graduate student to join my research group here, our research group, the Field Epi team, to do this type of research. And then I was basically looking for someone that likes surveillance, likes statistics, and likes data. That will be the three main areas that will be related to this type of work that I was interested. And then by that time, 3 years ago, I was able to convince Mafalda to come to the US and spend some winters with us and do her master and PhD at State University.
Perfect. That's really helpful background. I appreciate that, Gustavo. So, as we think about the work you guys are doing on sow farms, KPIs, health detection, let's talk a little bit more about the issue itself that presented you with the idea to start focusing on this area of research.
Yeah, so that's a good point. That's a good question. So all the idea started with a hypothesis when I was still a visiting scholar here at iState, I would say in 2017. And then I was discussing with Dr. Daniel Yaris and Dr. Bob Marson. Uh, uh, they use it to work University of Minnesota. If we could use productivity data to early identifying signals associated with potential health these health outbreaks. So we were more looking specifically with birds. So, and by that time, we were using just a few KPIs. And the main idea was that if we could use this data that they collect on an ongoing basis at the sow farm, we could early detect signals of potential disease introductions so they could test early. And if they find anything, or at least they can put the farm on hold and avoid disease spread. And in some circumstances, depending on where the outbreak started, they could also try to do any sort of weaning down approach in the ferrying house or test removal at the gestation. So we were looking more to that specifically to bring more value to the data that they already collect on a daily basis.
Thanks for sharing that, Gustavo. Mafalda, could you share more about the data that you were collecting and how it was being used to look at this issue?
Yeah, sure. So we started working with the sow performance monitoring from different record keeping systems, not just one. So we got data concerning, for example, abortions, dead sows, breeding mortality. And besides that, for one of the projects, I also worked with the electronic sow feeding systems. So I had the number of sows that were off feed per day and per week, and also the feed intake. That's for the breeding herd. And for the winter finish, I had data concerning the feed intake, estimated weight, and daily mortality. So for the breeding herd, it was more focused on the weekly data. And winter finish, I was able to have weekly data and daily data.
And then how did you use some of the weekly and daily data that you collected to start analyzing it and maybe coming up with some next steps and solutions?
So for the data gathering, I worked with different production systems, and they have different types of record keeping systems. So they either allowed me to have access, so either to an API or by email. They would send me emails every week with the data, with the sow performance monitoring, so with abortions, dead sows, breeding mortality, etc. That's one part. Then the other one was the data from the electronic sow feeding systems, and I work with two tech companies, so Maximus and Gestal, and they sent me that data. So I gathered all the data, and then I started implementing the models. But besides that, I also had the farm sending me weekly processing fluids, so I could compare the results that I was getting with my models with the results from the processing fluids, and to see if I had an alarm in my model, to compare that and see in the processing fluids if that's a true alarm or not, if that's PRRS or if that's like PCV. I was able to do that. And after doing that and comparing all the models with the processing fluids, I was able to see that I was getting alarms on average 4 weeks before the results with the processing fluids, the positive results with the processing fluids. And that was on average, but I was also able to get alarms 8 weeks before the positive diagnostic with the processing fluids. So I think that with this type of information, if this was implemented weekly in our farms, I think that the producers would be able to act fast or faster than they are acting nowadays if they have access to these type of alarms. And with that, make interventions earlier that would minimize the impact that an outbreak has in the farm.
So, what kind of systems do swine operations need to have in order to do this testing in regards to health prevention?
I think that our work was focused on taking advantage of the data that is already collected in our swine farms. I worked with different record keeping systems just focused on the cell performance monitoring, and also I also work with the electronic cell feeding systems. I know that not all the farms have that, but recording off-feed events and feed intake is something that is also commonly done at the farms. So there's no need for the producers to start investing a lot in other technologies. They can just take advantage of the data that they already collect and look at the models we worked with, look at the results that we got with our studies, and try to implement that in their farms. And actually, we have in our website, in the Field Epi website, we have 2 different tools that the producers can look at, and they can contact with us at any time, and we could help them take advantage of the data that they have.
As you think, then, key performance indicators are some of those things to be able to help indicate herd health, amongst other things. How did you go about deciding maybe what KPIs to focus on, or how does that translate to folks working in swine barns and what KPIs they need to pay attention to?
Yeah, I believe for the so far, so everything we started, we did the initial work with first. So basically, to define which KPIs we would look at, we were just looking at the signals, clinical signs that was associated with PRRS outbreaks. So with those, we decided to use the number of aborts that they collect at the cell farm. We decide to look at the prenatal losses, that is the combination of mummies and stillborns. So basically also clinical signs, mostly common related with PRRS outbreaks. We did take a look at the cell death as well. That is, I believe those 4 would be basically the big 4s that we look at initially. And then Mafalda, using the soil electronic feed intake data, she was able to look at the off-feed events. That also a very important sign of infectious disease. So animals go off feed, and then by looking at how many animals were going off feed, we're also we were able to take a look at a very important KPI as well.
As you think then about some of the subsequent work that this has led to, Gustavo, talk to me about some of that.
Yeah, so the subsequent work that we did, so basically Mafalda did all the heavy work on collecting the data and developing and validating the models. But one thing that also people from the field, more specifically the first task force from the American Association of Swine Veterinarians, they were requiring something more straightforward, boots in the ground approach. So that's when they asked the question if we could try to find patterns in the data, at least put together a formula that they people at the ground level could use to at least trigger investigations. And then that's what we led to developing the clinical case definition that Mafalda can talk about more into the details.
Yeah. So, concerning the PRRS clinical case definition, um, actually, that the work started with Dr. Silva, and then I picked the work 1 year later, I think, and I started gathering more farms and looking at the same KPIs. So prenatal mortality, death, sows, abortions, prenatal losses. And the main goal was to come up with a workable clinical case definition that would help the veterinarians to have a reference for when you have something going on at a farm and more specific PRRS. So after working with different models and trying different things, the final clinical case definition was using a simple 15-week moving average with 2 standard deviations with combinations of KPIs. So not looking just at one KPI, looking at different KPIs, combinations of abortions and prenatal mortality, abortions and prenatal losses, for example. And after getting this final clinical case definition, the main goal was to come up with a tool that the producers could use at their farms without having the need to send their data to anyone. And that's why we try to make it as simple as possible. So that tool is also is available at the Field IP website, and it's just a simple Excel spreadsheet with different examples of how to use the tool with charts. And you just need to, you can download it and you just input your data, your number of abortions, and all the calculations for that will be done automatically. And the result will be you have an alarm or you don't have an alarm. Then with that, you can move forward to what's the next step. And we also provide diagnostic table that can help you with that. So if if you have an alarm, for example, and you have a farm that is a status 4, what kind of diagnostics should you do? So that's the main goal for this tool.
Can you share more about how you arrived at this final definition?
The first task force started this project, and the main goal here was to create a clinical case definition that for PRRS that would be easy to implement in the field. And the importance of creating a clinical case definition is that it allows the producers to to monitor the disease trends. It facilitates for outbreak classification and investigation. And also, it aids in early detection of an outbreak. So, taking that into consideration, the working group that was created by the PRRS task force and the ASV PRRS committee decided to create something that was based on averages and standard deviations to be easily implemented in the field. And the type of KPIs that were used were the same as previously mentioned, so abortions, prenatal losses, prenatal mortality, and sow death rates. And after working with different types of moving averages, standard deviations, and looking at different combinations of KPIs, the final equation that we came up with was using 15 weeks of moving average with 2 standard deviations and combinations of KPIs, followed by diagnostic investigation. And you can find all of this in our website and in our tool if you want to know more about how all of this is done. But basically, concerning the results, we could see that on average, we had early detection of these using these KPIs and these equation. The early detection was on average 4 weeks, and we had a pretty low false negatives and false positives. So a false positive would be having an alarm and not having PRRS on the farm, and a false negative would be having PRRS and not having an alarm. And we had pretty low, so the false negatives were below 3%, and the false positives were below 12%. So it was not that high. And after talking to the working group, everyone agreed that having some false positives would be something normal to have, but they really, really wanted to minimize the false negatives. So I think that with these two, we achieved that.
Can you also share with us how this may impact the wean to finish process in swine production?
Basically, after doing all the research at the sow farm, we basically started to test different approaches on the win to finish side. And then Mafalda come up with the idea to develop benchmark curves using mortality data to do basically the same thing, but for the win to finish. Since during the win to finish phase, people do not perform a lot of active surveillance using diagnostics. And we just usually perform diagnostics more in a reactive way when we saw clinical signs. So Mafalda put together uh, some models to build to win to finish curves, benchmark curves, to be able to early detect any signs of that.
Mafalda, anything else you'd like to add?
So I can say that for the win to finish benchmark curves, I'm working with daily data that that belongs to one production system, and for that production system, I also have access to diagnostics, so I can do the same type of approach that I did for the breeding herd, where I kind of compare my alarms with the dates of the diagnostic results. And with that, I can see how earlier can I detect that something is going wrong in the herd. As I said, this type of benchmark curves are specific for the production system and not for the farm. So what I'm doing with that is that I'm building these benchmark curves, and to validate them, I'm plotting them or comparing them with winter finish lots that I know that had some health issue, either a PRRS outbreak, a PED outbreak, something like that. And then I can go put them side by side and see how earlier does the case or the health the health challenged lot has a spike or an alarm before the diagnostic is done compared to the benchmark curve. And I can see that on average, I have that 5 to 6 days before the diagnostic. But I start having alarms like 10 days before that.
So, Gustavo, what's the importance of producers using this data?
So at the sow farm, with the models that Mafalda developed with statistical models, you can detect up to 8 to 4 weeks before the sow farm diagnose the PRRS outbreaks using processing fluids. And that winter finish using the daily data, you can go from 5 to 10 days early before you perform the diagnosis. So with that time, you can proactively manage or change pig flows, or at least try to decrease potential disease spread of the virus, or start early medications to reduce the economic impact of the outbreaks. So I believe it's very useful information that people at the barn level can use to early identify signals and proactive act against disease outbreaks.
As we wrap up today's episode of the PigX podcast, let's recap. First, we explored methods for identifying health issues in swine herds. Then we chatted about some of the PRRS definitions based on the TWO's research. And finally, we talked about some actionable steps to address those issues. You can find more details about their research and resources in our show notes for today. We'd like to thank Dr. Gustavo Silva and Dr. Mafalda Mil-Homens for coming on to today's podcast. And thank you for joining in and learning about all things swine. Be sure to come back next month for another insightful conversation. Until then, I'm Delaney Howell, and this has been the PigX Podcast.
PigX is a national podcast hosted by the Pig Livability Project partners at Iowa State University, Kansas State University, and Purdue, and supported by the Iowa Pork Industry Center. For more information on the project, head to www.piglivability.org, or to inquire directly with questions regarding the project, email ipic.iastate.edu. PigX, ideas in the swine industry worth sharing.